Hey out there. I'm Timo from Nursebeam, and together with me, I have Dr. Tareq as well. And I know you're probably worried. We are talking about COVID-19 all the time, but there is something that is actually like a ticking time bomb coming up, which is even more severe than COVID-19. It's not cancer, but this is antibiotic resistance. And we are currently just concluding the World Awareness Week on Antimicrobial Resistance. And together with me, we have an expert, a world-leading expert on the matter, Dr. Tareq. So maybe let's just start and let's maybe open the topic by explaining what are antibiotics? Because we know that there are viruses, there are some kind of fungal infections, and there are bacteria that can cause trouble too. What is the difference between them and what we're actually using the antibiotics for?
First of all, hi to everyone who's listening out there, and thanks, Timu, for bringing a light to this amazing and a very, very important topic, something, the real pandemic, along with COVID-19, what's happening right now. So what is antibiotic? Each one of us have felt sick since our childhood till now, thousands of times. So whenever we get sick, usually it's a microbe. Microbe can be bacteria, it can be virus, it can be fungus, or it can be some other related organisms. So normally antibiotics is a drug or a medicine we take to kill bacteria whenever we get a bacterial infection. Probably some of us will going to get a chest infection. Sometimes some of us have a throat infection. Most of the time, it's a bacterial infection. So when we take a medicine to cure ourselves from that disease, that particular medicine is known as antibiotic. And similarly, we take antivirals for viruses which infect us. For example, right now, COVID-19 is out there. COVID-19 is actually a virus. So this is the problem. Probably you have also heard from the news in the beginning that there's no medicine. And then a news came up, so remdesivir is considered as one of the medicines. So actually, it's antiviral medication is needed for viral diseases. Antibiotics are needed for bacterial infections. Antifungal medications are required for fungal diseases.
So, I mean, that means that usually I think when people feel more seriously ill, the doctors are prescribing the antibiotics. Then this means that antibiotics, they don't help and
I think you bring discussion to a very important and a very critical discussion in antimicrobial resistance. So actually what happens, whenever we get sick, doctor prescribes a medication.
Yeah.
By procedure or by standard operating procedures, SOP, first our bacteria or microbe should be tested in the lab, and it should be evaluated that which antibiotic or antimicrobial, first line, second line, third line, is suitable to kill the microbe which is causing the disease. Unfortunately, that's not in a practice. What happens whenever a patient go to a doctor, those medicines which are used commonly in routine without testing a patient's bacteria, it's just given to them empirically, and patients take it and patients consume it. So actually it sets a cycle where we are treating, or clinicians are treating, a lot of infections without having a detailed microbial analysis. So that forces the whole paradigm to shift in using much stronger antibiotics, which are not needed in most of the cases. So this is how actually it starts. And generally bacteria or microbes, they have this tendency to evolve and mutate and become stronger and stronger. One thing, probably I'm also guilty of that, and I think a lot of us are guilty of that, that when we are prescribed the antibiotic to take it for 7 days or 10 days, after taking medicine for 3 to 4 days, we feel good, and then we stop taking it further. So actually that problem is one of the root cause of this antimicrobial resistance. So what happens, even if you kill 99.9% of the bacteria, that 0.01% of the bacteria that survives, it becomes stronger and stronger. So next time when you give the same antibiotic, that bacteria is resistant. So this phenomena is called antimicrobial resistance. And this is what's happening a lot, especially in this season right now with respect to COVID. A lot of infections are out there. And a lot of people are taking antibiotics even when they have some kind of a viral problem. And probably in a lot of low middle income countries, especially also in some developed regions, people who are having a COVID-19 infection, they are taking a lot of antibiotics with an assumption that it will going to help them from bacterial infections. So this whole widespread consumption of antibiotics is massively bringing us near to the brink of this emerging time bomb, which is the AMR pandemic.
Isn't it also like, I was actually just thinking that antibiotic as they kill, like, I mean, you said that often the doctors prescribe this kind of widespread ones that they kill like different bacteria, that if you are consuming antibiotics, I mean, without the need, actually, can they weaken your organism and maybe that reduce your immune system in a way that, let's say, it's easier to get other infections thanks to using wrong antibiotics? Is that correct?
Very good question. Yes, it's correct. So normally what happens, antibiotics have been classified in different ways. One way we can categorize them is a broad spectrum antibiotic. Broad spectrum antibiotic means if you give one medicine, it will going to kill a huge range of bacteria, right? That's a broad spectrum antibiotic. And another category will going to be a more specific or a narrow spectrum antibiotics. Normally what happens, which is bad, but it's quite common, that when patients visit doctors or even in hospitals, broad spectrum antibiotics are given to the patient. So yes, it kills the targeted microbes as well, but at the same time, it also kills a lot of natural flora or the natural microbes which lives within our body. Maybe you have heard of it that, some people have taken an antibiotic and after having antibiotic, they started to have a diarrhea. Yes. This is one of the problems with some antibiotic. And this thing happens because that drug which is consumed, it kills the good bacteria inside our body. And once that good bacteria is gone, we have another infection. So taking a right antibiotic for a right disease or a right bacteria in a right quantity at right time is very important. Otherwise, we become victim to this whole issue.
And currently, like, I know that you have been doing research on that. You were doing research in Pakistan, in Singapore, Nanyang Technical, and you were also working with a MIT leading scientists in the field. Like, what are the tendencies? Like, I mean, I understand those superbugs or superbacteria that are getting way more resistant. Like, what are you predicting for the next, let's say, 10 years? Like, I mean, how severe this problem actually is?
Okay. I think you have asked a couple of really huge questions in a one simplified question. Okay. So normally, first what I was doing my research was about solving this problem of finding a new antibiotic which can kill those bacteria which are now resistant to almost all the medicines out there. So there was a recent discovery happened by one of the Northwestern universities in US. They identified a very new molecule, a new antibiotic, which is considered as one of the revolutionary molecules discovered in last three decades. That molecule is known as Tyxobactin, and that is considered to be one of the solution for this global health threat of antimicrobial resistance or antibiotic resistance. So this is something I did my PhD on, and I synthesized that molecule, and I was like among the few people in the world at that time in 2016. when I finished that, and it was while working with MIT and Nanjing Technological University. So what I did, I actually developed a new molecule, hopefully which will going to save millions of lives in near future, which can kill the drug-resistant bacteria. Okay, now what happens? Actually, every bacteria has a tendency to evolve and become resistant until and unless it's killed properly. So if you kill a bacteria properly by using a right antibiotic in the right dosage at the right time, that the problem is solved. But if anything is missed and bacteria is not totally eliminated, then even a very small part of that bacteria learns that, okay, this is the drug or the molecule which has killed me. Now let's evolve and make yourself resistant to that incoming drug or incoming antibiotic. So this is actually what happens. Now, with respect to our gut hormones, as more antibiotics are consumed by us, and as more and more antibiotics are used in the animal industry, like we eat a lot of people eat a lot of meat, and we take a lot of plants and all that. So when antibiotics are also used in their growth, in meats, even also in plants, it make those bacteria which reside in them also resistant to antibiotics. So this is how it becomes really, really interesting that yes, if I'm a person, I'm taking an antibiotic, and if I'm not taking it properly, bacteria inside me can become resistant. But if I'm consuming a meat, or if I'm consuming something else in which antibiotics have been used, so those bacteria which I'm taking in along with that food also have an antibiotic resistant gene in them, which makes this whole problem way more worse. So actually antimicrobial resistance has 3 layers: human, animals, and environment. So antibiotics consumed in animal industry, that bacteria's inside food, inside meat becomes resistant, which I'm eating, right? Or a lot of us are eating. My environment, the water I'm consuming in, even some of the plants I'm taking it gets some essence of the antibiotic consumption in environment, because whatever it's consumed out there, it's at the end of the day, it ends in the environment and it has the traces in water. So these are the 2 layers. And another layer is clinicians are not prescribing antibiotic in the way it should be, and consumers are not taking it in the way they should be consuming. So there's actually a 3-layer approach which is making this whole problem worse and worse. So this solution is like that. And with the COVID, with the massive use of antibiotics, it's not only getting bad, it's going worse. And I don't think so humanity is ready to see a pandemic of this scale, which is actually quite close. And COVID-19 has just accelerated that.
I mean, this is super fascinating. And I understand that, also now the precaution measures to avoid that are different. That one thing is the super new drug that you were developing and hopefully saves millions of lives in coming years. That will be like a sniper and killing out the bad bacteria out there. But I understand that, let's say me or you as a everyday person, I mean, what could be the steps that I or you could do then to maybe help combat this problem? That I think one thing is, that there will be this kind of the new super drug, but maybe there are also some simple steps that our people who are watching our show today, maybe if they are clinicians or just let's say anyone out there, what would be maybe some steps in the daily lives that they should change in order to reduce the risk of getting infected with antimicrobial bug, or getting a serious infection on that front?
Very good question. Okay, the first thing what me and you should do, or anyone who's viewing this can consider, is whenever we are prescribed any antibiotic, we should take it for the whole duration for which it is recommended. We should not stop it in the middle. Then if I hope some of the clinicians or some people who are doctors who prescribe antibiotic will also look into this issue, that whenever they're prescribing an antibiotic, they don't prescribe it, like using a missile for even something small. They should do a lab test. They should confirm that, yes, is this antibiotic actually needed for the patient? And normally when they start treatment, they should not go for the last drug of defense or the last line of defense. They should start from the first line of defense. If that don't work, then second line of defense. They should not go at their silver bullet, which is quite common, unfortunately, right now.
So it's better to select maybe not that strong antibiotic in the beginning. And as a patient that, let's say, if the doctor says that, hey, you should take it 10 days, that even if you're feeling good on day number 7, you should still have those pills for extra 3 days, right?
Exactly. Yeah, this is one part. And frankly, I will tell you that I have a chance to visit some part of the world and I got a throat infection and I just took I was having I knew it's a bacterial throat infection because of certain symptoms and some of the ways because I myself is a healthcare professional. So I took first generation antibiotic. And a lot of people, even the doctor there was quite reluctant in prescribing me that. I said, no, I know what I'm doing. Let me have it. And at the same time, a lot of the other patients they were taking third generation cephalosporin, which is more like a strong category. So this should not be the practice. At the same time, this is what humans are doing, that human is prescribing and human is consuming. There's another huge area where we can probably contribute. And if we have anyone who is involved in, animal farming and all that, we need to educate that whole community that you don't need to use antibiotic randomly or just to increase the yield and just with the fear that, your animal will get sick, you are feeding them a huge amount of antibiotic in their diets every day. That's just crazy. This should not happen because it has a huge cost, but at the end of the day, everyone has to pay. So first, me and you as a user, whenever we consume antibiotic, we should complete the course. If we are in a position to prescribe the antibiotic, we should prescribe it carefully. Then let's come to the food because, every day we need to eat, we need to remain alive.
Yeah.
So if we can actually go for organic, that's the best thing we can do. And more than doing organic, if we can spread awareness. For example, if I go to my butcher and I will ask him that, the place from where you get all these animals, are they feeding them antibiotic? If yes, then actually you are putting the future of your kids and I'm putting the future of my kids in much more danger. Because probably after 20 years, even a small infection can actually become incurable and that can kill. And we have to stop because food is actually a huge source for causing that problem. At the same time, we also, in order to prevent antibiotic, we also have to see and manage that, whatever water we consume, it needs to be treated. For example, let's assume I should not discard anything which has antibiotic or antimicrobials in its composition directly to the environment. Technically, I need to, neutralize it before doing anything like that. So at human level, at animal level, and at environmental level, first we need to improve ourselves. And at the same time, with respect to this video, one thing I would like to say, antimicrobial awareness is a huge and a long process. We need to continuously aware about this issue. WHO has organized that awareness week. Yes, very good. But how I feel, that's not a 1 week thing. This is something we need to do every day. I need to teach, and each one of us have to spread this message every day that this is a problem. This is what we need to do. And this is how we can protect ourselves and our children's. So with respect to this transmission, actually, I would like to start the antimicrobial awareness movement Because for me and a lot of the other experts globally, like my colleagues, all of them believe that it's not a 1 day or a 1 week thing. It's something we need to do every day in order to stop the emerging pandemic.
Yeah, because this, I mean, for me, like what you have been explaining, it seems like this is way more severe, like in a way that, I mean, okay, now with COVID-19, we have like wash your hands and wear the mask and keep social distance. But it seems like and it's really like in your like water, in your food that you eat every day. Like, I mean, you have to eat, I mean, otherwise, and drink, otherwise, I mean, it's not possible to stay alive. It seems like way more complicated and definitely something that is way harder to solve. But at least I understand that differently from COVID-19, where we have to be socially distant, that we are, at least in that kind of pandemic, we are allowed to meet each other, that it's not infecting us through the air, right?
Actually, you have raised a very important point, and I would like to say something. Okay, right now, if you look at the pattern of COVID-19, yes, it transmits very, very fast. But at the same time, it has a survival rate of more than 98% of the people, they survive. Yeah. Even more than that, that's good news. Another thing with COVID-19, the young infants, children, even many teenagers, the death rate is not as much, right? Mm-hmm. And the death rate is higher as the age bracket goes up. However, for antimicrobial resistance, things are quite worse. I don't want to imagine that scenario, but actually it's possible that let's assume we get 100 patients of AMR, antimicrobial resistant, and probably there's another term, maybe you have heard superbug. Superbug is something which is so strong, no antibiotics work against them. So actually antimicrobial resistance means that we are having superbugs everywhere, or we are having many superbugs in our environment. So let's assume if we have 100 patients, imagine 20 of them will not going to make it and they're going to die. And there's nothing you can do about it. You will not be able to produce a vaccine in 12 months, which thankfully we are in the verge of doing it right now. Imagine a kid who's born, he's not safe. Imagine a person who has a single hospital visit, he's not safe. Imagine any person who have a surgery, he's not safe. Imagine any person who even get a scratch on his skin, he's not safe. So this is the scale of what AMR can do. Yes, it will not transmit from one person's breathing to other person's, hopefully, but the time duration we need to develop a cure, I don't think so it's possible to squeeze that time duration in months or even in 1 or 2 years. So if that started to happen, then the death rate will going to be massive. Something we are not ready for that.
And I understand it's like also like complicated in a way. I mean, you actually mentioned even that. Is this correct that you might get those superbugs, you said, like at the operation or in the hospital? So you go maybe with a small scratch, I don't know, you have some kind of small accident, an open wound, you go to the hospital and you could get that superbug over there. Is this correct?
Yes, it's correct. And with respect to that, actually, I have a very personal story because of which when I started my PhD at that time, I had an incident in my life which triggered my motivation to actually solve this problem. And once I dig in, it's bad. So hospitals are actually the houses of superbugs. Outside or in a lot of other places, you don't have a superbug, but hospital is actually one of the only places where you have a superbug. So you get any kind of a wound, you have any surgery. If you're in hospital, you have a high chances of getting an infection. And if you are in a low middle income country where somehow the resources are not that much, and unfortunately there are way more superbugs, so your chances of getting something bad is really, really high. And the personal story I have a very close friend, another healthcare professional. He lost his arm because he was in hospital and a really drug resistant or an antimicrobial resistant bacteria has infected his arm. And it was so bad that they have to cut his arm to save the rest of his body. So,
and is there a particular way that it happens through the wound? Or, I mean, for example, like what we see currently often in the media, it's like, hey, we need ventilators to put the COVID-19 patients. Is it something that even can spread through those ventilators maybe that can cause those superbugs?
Okay, like there are a couple of bacteria which lie in the category of superbug. Superbug is actually a bacteria against which no antibiotic works, right?
Yeah.
So those bacteria, some of them can be aerosol. Usually they are not that much. Aerosol means which can transmit from one person's breathing droplet to another person, more or less the way coronavirus transfers. But there's a very small percentage of that. Most of them resides on some kind of a surface. And with respect to ventilator, yes, ventilator is actually a huge source where you can get a superbug. There's also a complex mechanism of how it can happen, but anything on which bacteria is lying down and you put that on your face or on your body and it's exposed to your body cavities or wound, then you're at the very high risk of getting a infection, even a superbug. And if you get a superbug, then you need to be lucky that whatever antibiotic out there hopefully works, because if it don't works, then your survival chances is slim, which is bad, but which is common, and it is becoming more and more common. This is something which is really, really alarming right now.
This is like super fascinating topic, and I think it's something that we could even do a separate edition on that, because I don't know, like in my mind, I was even like popping up the question that now when we have like this COVID-19 pandemic currently going on, like, I mean, I can only like imagine that it can also help to spread those superbugs when like people are like lined up in hospitals and we don't have like enough time and resources to maybe clean after every patient. That this could be like hidden in one pandemic is hidden the second one that is even more severe.
I think it's not just hidden, it's already there, and it's just like standing on the top of us. But okay, just imagine a building which just collapsed right away. So everyone is aware, okay, it's collapsed and it's happening. So when coronavirus comes, it have a lot of noise. High transmission ratio, numbers are going high up. Yes, some measures are being taken. AMR pandemic, it's something, a huge tall building which keeps on getting people inside it more and more and more, but its base is very, very weak. And at any point, it will not just collapse, it will cause annihilation of all those people who are in that cloud. So this is where it's get really, really bad. And unfortunately, with the COVID-19 pandemic, if it's COVID-19 pandemic is like that, the AMR pandemic is actually already like that, stacking on the top of it. And the more fast we are consuming antibiotics, yes, at some areas we need it, but I have seen patterns that people are consuming antibiotics, especially azithromycin, like a candy. Yes, in certain cases it's useful. Yes, it has been reported to be quite useful in preventing secondary infections during COVID-19, but we need to have a framework to define some limits that how to control this rampant use, which is happening just crazy right now. So until unless we will not control that, then I don't want to imagine that, but unfortunately we can have that pandemic probably in coming few years. And if it happens, then I don't know what will going to happen, because as an antimicrobial resistance drug development scientist myself, even worked and discovered something really a new molecule, I know not only this whole process is so hard, it's actually one of the most challenging thing to find a silver bullet which can kill drug-resistant bacteria and which can actually make it to the final stage of being a drug that can use in the clinical practice. After 1960s, we don't have much antibiotics used in the practice. And after that, the rate is just getting bad and bad and bad.
Well, I mean, I hope we managed to kind of survive this and find new ways. I think one of the interesting ways to maybe change the healthcare is also that, I mean, considering that getting to the hospital might be like a place you can get infected with this new kind of bacteria. What about digital health? I know that at Nursebeam, we are like creating medical chatbots that helps travelers to find the right drug and the only drug they need in their care, avoiding going to the hospital and clinical setting in the first place. What do you think like is the potential for, let's say, digital health solutions to kind of like help people to get care, but maybe in more specific ways to avoid drug overuse, antibiotic overuse, and like those meetings in, let's say, hospital settings where people can otherwise get infected with the drugs? Like, what do you think is the potential of digital health solutions in the next 10 years, let's say?
Not only I will say digital health has an immense potential, but I will say digital health is the future of medicine if we want to control such pandemics. For example, right now, what digital health can do with respect to AMR? The first problem is a problem of awareness. We need to explain people how bad it is and how it can actually impact you and your life and the life of your loved ones. A lot of people don't understand this. Number one. Number two, it can help people access healthcare services sitting at their home or sitting at the place where they don't have superbugs around. If you go to a hospital, your tendency is quite high. Then a very important area where I'm quite glad Nursebeam is working on is whenever you move from one area, which is somehow have less superbugs or better hygiene or less problem of antimicrobial resistance, you go to another area which have a huge or a massive superbugs or antimicrobial resistance problem. Not only you are at the huge risk of getting something really, really deadly, you will also bring it back to your home, just like Corona. You know, like you go to one part of the world, you come back, and you bring that stuff with you, and now your whole community is at the threat. So Nursebeam is really good in kind of bridging up that gap that when one person travels to one location and he goes to another location. And I hope in future Nursebeam will be able to make that really amazing system which have a public health indicators as well, that, you know, this part of the world location has a bad threat. So you need to be more careful. And these are the medicines or precautionary measures you need to take with you so you don't get infected at the first place, which is more like a preventive healthcare in the travel medicine and all that. So yes, digital health has role at different stages: awareness, getting connected with the healthcare provider, getting right services at right time. And digital health has a very good angle in actually having a really unique clinical auditing mechanism, which is something amazing in terms of having a patient's rights with the concept of being a global citizen. For example, right now in US, if a doctor will not going to treat me right, I can sue him. But unfortunately, I don't have this luxury in many other parts of the world. Why? There's no awareness. So Nursebeam can actually not only become a system, Nursebeam and other digital healthcares, a platform where we can access a lot of healthcare services, we can get awareness to a lot more. It can actually become our clinical advocate, for which you generally need to hire a very specialized lawyer and all those stuff. So the way I see future is with digital healthcare. Why? Because the amount of services you can get and you can give to one person, it's ridiculously amazing. And the way you can replicate that service to not million, but billions of people, that's a game changer. And yes, we need to have an infrastructure to support that, but definitely with respect to the COVID-19, as a lot of people are already working from home, the whole humanity has been pushed toward more digitalization. So any digital service of quality will going to create a huge impact in making our lives better. And I'm glad Nursebeam is doing that.
Well, I mean, it has been a very interesting journey for us. I mean, actually, a year ago, it was another, like every November, WHO has this awareness week, and we did our first antibiotic resistance chatbot, and it was like so surprising to see that. I mean, with almost no advertising, we got users from so many countries, and we could see like people are really curious to learn about this topic. So, I mean, we are happy to this year, even like in addition to the existing bot already, to do this special edition videocast as well. But besides our chatbot, which is like nursebeam.app/AMR, you can learn more. What would be maybe some good reading materials you would suggest our today's video visitors who want to learn more about the topic? Like, where should they turn to, or what should they read?
Okay. Frankly, what's happened out there, if you go to the WHO website, try to search something about AMR, there's good information, but that have a lot of jargons and a lot of technical information. So that becomes a little bit more difficult. So I think a good start for a lot of the users can be go to the Nursebeam website and visit the AMR chatbot. That can be a good start. It has an option to subscribe, and probably once they subscribe, the contact details are there, so we can share more and more easy to understand articles, which will make it more easy for everyone to understand. Not with an information overload, but something which can be absorbed by an audience and can make a difference. And yes, this year, we don't just want to have a chat, but we actually want to have a movement where we will keep on growing this network of making you more and more aware. So I'm thankful to Nursebeam, I'm thankful to Timu. This is a start, and we are really looking forward to making everyone aware about AMR and equipping everyone with the right tools to fight it together.
Okay, this is amazing. Thank you so much, Hussen, for joining this edition. Thank you everyone for watching. And as said before, like if you want to stay updated for more news on this topic, check out the WHO website, and of course, also subscribe for Nursebeam. You can click here the subscribe button on this YouTube video, as well as click subscribe if you scroll down on our website, and you would be subscribed to our news where we share more content, not only antibiotic resistance, but how you can like stay healthy, safe and sound around the globe when you're at home or moving around. Thank you for watching, and see you soon again.